Thank you, Teresa. That was great. And we'll be talking more about some of those issues when we do our exercise. Next is Larissa Estes from Houston Department of Health and Human Services. And if you want to come up, I'll put your slides up.
Good afternoon. Can you hear me? Okay. So we're from the mighty city of Houston, Texas, and I think a lot of people think we're big and we've got it together, but as we've learned through our community health assessment and community health improvement process, and even through Teresa's presentation today, you can always tack on 3 to 6 months to whatever you're thinking as it relates to public health accreditation. And so today I'm going to talk to you a little bit about our process that we used in Houston to move forward in our community health assessment, community health improvement plan process. So today I'm going to talk a little bit about some of the existing community health assessment resources. We talked a little bit about this yesterday with access to data, but there are tons of resources out there, and it's about identifying what works best for your community. Also looking at methods that are applicable to your community, whether it be putting together data that's already existing, actually getting out to the community and surveying the community directly. There are a lot of different ways that you can gather information about the community to understand its health. The community health improvement plan process, that's a beast in its own. And how does that really work for you in your community and using existing resources? And then adapting a plan process to meet your community's needs. So challenges and solutions, there are tons of challenges, but these were two that really came up in Houston. We have a lot of different health assessments in Houston, so which one do you choose? Well, for us, we started with what is FAB saying to us? And FAB, there's really a lot of room for interpretation. You can go in a lot of different directions with what they give you. So for us, it was really just focusing on what are they saying and how does that fit in within our community? And particularly reflecting the community's voice. I think a lot of times in health assessments, we're gathering data, whether it be from BRFIS, or National Health Interview Survey, or a lot of other resources out there, and the community voice is forgotten. And so really making sure that the community is at some level engaged in the health assessment process. We can't address every issue. That's something that, you know, in public health departments, we're constantly thinking we can't do it. Well, we can, because we have partners out there. And so it's about networking with your partners, identifying existing partners, and determining how their efforts can work with your efforts and to create a true community health improvement plan. So here are some existing resources. You have the Health of Houston survey that was a community-based survey, and it actually engaged the community through a survey of community-based organizations, membership groups, the 2 health departments in Houston and Harris County, as well as neighborhood and civic associations. And they had 151 responses representing 89 organizations. And what that did is it helped identify priority topics within the community to then create the community health assessment. With that community health assessment, they were able to survey 5,000 households. And with that, we were able to drill down into the sub-county level and get sub-county neighborhood data. So you could actually identify what a health issue is in a specific neighborhood and drill down into addressing or creating programs and plans to address those specific issues. The Houston Harris County State of Health, that's another one. And this is a little bit different because it actually took existing data sources and combined them into one health assessment. So these are 2 different types. So you can go out and you can survey the community, or you can collect data that's already existing. Assessment, Intervention, Mobilization, AIM. This is a huge project that the Houston Department of Health and Human Services does annually, where they identify a neighborhood within the city of Houston and conduct a rapid assessment. And last but not least, I think this is kind of a deadly word in the state of Texas right now, the Medicaid 1115 waiver. We all hate to hear that word, but actually what I learned is that there are health assessments that are on some of these waiver websites that you may be able to tap into and utilize as your community health assessment. So with AIM, AIM is something that's very different. And the idea behind it is really to promote a better understanding of your community and draw attention to those matters that contribute to the greatest health disparities of our growing culturally and ethnically diverse communities. Actually, right down here is a map of the city of Houston in Harris County, and you can see kind of the sub-county level area where Houston can actually go in and actually survey some of these neighborhoods. So it's actually a grassroots effort. We go in with the neighborhood and ask, what are they interested in? How can we help you? We do door-to-door assessments, we provide linkages to services, and then we do immediate follow-up to the basic needs of the population. And what's really great about it is it provides a snapshot of health indicators in the specific neighborhood that is selected. So how do we do this assessment? There's a goodie bag that we put together at the health department that is left on everybody's doorstep. And what's in the actual goodie bag is health information and a questionnaire. There's a cover letter that describes what the questionnaire is, and the questionnaire really just covers general health topics, some specificity on chronic disease, and demographic information. And the general health question, so you want to know, how can you do a short, quick health assessment, a snapshot? They ask questions such as, overall, how would you rate your health? Have you seen a doctor in the last 12 months? Insurance status, medication use, diet and exercise, exposure to violence, disaster preparedness, internet access, and then specific health conditions that are particularly chronic disease, diabetes, chronic pulmonary issues, asthma. They also have demographic information such as gender, education, children in the household, the materials that they actually receive in the bag and how helpful they are, and where they actually get their health information. Do they get it from the internet? Do they get it from their primary care physician or some form of a medical home? And just as a note, hopefully in the near future, the health department will develop a full-scale training on how to implement AIM, which may be useful in some of your communities that are a little bit smaller than a city such as the size of Houston. So the waiver. The Region 3 website actually lists 62 community health assessments that have been done. I haven't taken a look at any of the other waiver websites or if there are even other waiver websites that do exist. But if you take a look at this list, it's a laundry list of existing resources. And so something like this may already exist in your community. So I really encourage you to get out there and ask your partners, have you done an assessment lately? What does it say? Can we have access to it? And this is just a makeup of the regional websites. Just in case you're not involved, you might look to see where your region is and take advantage of if they have a website. I'll leave that up for a second. So with prioritizing health topics, it's really important to review the community health assessment to determine what health indicators are truly important and what health indicators you as a community or a health department and your community partners can address. And what we did with the City of Houston is we really sat down and looked at what are the things that we do within the services we provide at the health department and who are our partners that are out there that can help us attain or reach or identify and address some of these health issues. So these are the topics that we came up with. And it was really important to consult leadership, I think, and really engage them in this process because they can help filter it down through the frontline staff. Identify your internal and external stakeholders. We talk a lot about engaging stakeholders, and you've got them sitting right next to you. You've got them across the street from you. It's really, really important that you engage anyone and everyone who can be involved in your process. You've already got existing relationships. Use those, leverage those existing relationships. What we did with existing relationships is we identified community-based organizations or coalitions that had kind of membership groups so that you had a broader network of people to reach out to and connect with. And so we created a form for each one of these membership groups to complete. And whether it was the membership group in the broad or members individually within those membership groups, we collected information on data, their desired results. So what did they want to see happen with this particular health issue, whether it be HIV or obesity? Investments in action. What are you actually doing? Are you using any evidence-based practices to address these health issues? Recommended solutions, and Kathy mentioned this. This is about policy. What are the recommendations you have to change policy and practice? Because once you get, it's great to have the plan, but you have to move it forward in feasible, recommended policy and practice efforts. Consolidating information. This is something that I think we're in the middle of right now, because you can do really a community health improvement plan on any one of those topics you saw listed. It can be a very, very daunting task. And we talked a little bit in this morning session about, this is very big and broad. You have to kind of bite off what you think you can address in a certain amount of time. And so what we really wanted to do is be concise. We can meet and be a little bit more strategic as we get into smaller groups, but it's really important for the plan itself to be concise and very direct on what we're looking at. So we looked at sharing the topic sessions with stakeholders, which we're in the middle of doing right now, and gaining feedback about the information that we collected, how we organized it, and how they may feel about how the information is presented. Again, it's continuous community engagement and feedback. And always be open to revising it as necessary. These are living documents. As much as these plans are supposed to last 3, 4, 5 years, things change. The climate changes, and so you have to be open to adapting to those climates. So this is a little bit of a sample of the document that we are starting to put together. And what we've done is we wanted to make sure that it was rooted in data. So we decided to do some area maps and some bar charts to really show what some of the health issues were. We came up with identifying some of the programs that are currently ongoing to address some of these health issues that were identified, and then policy and practice recommendations. What changes do we need to work towards in order to improve the health of the community as it relates to this topic area? And this one here, for example, is maternal and child health. So lessons learned. Use your existing resources. You've got people, you've got products. It's really about opening up the communication lines and talking to one another. Persistence with follow-up works. You have to bark down people's doors and bug them and send follow-up emails, phone calls, show up. I like showing up at meetings because then I happen to say, hey, by the way, you owe me something, thank you. It's a really effective way of getting people to engage actively and participate, and they remember that. And so when it's time again for them to review something, they don't want to get all those calls, emails, and pop-ups at their office. They're more than willing to respond right away. Community engagement is crucial. You'll hear this time and time again. That's one of the underlying, I think, elements of accreditation, is really engaging the community in this process. And a lot of times the community is left out, so it's really crucial to engage the community. And last but not least, the community wants to work with local health departments. This is something that we thought was going to be a very daunting task. We identified our community-based organizations, we started to contact them, and they were more than willing to fill out our form and to engage us and to invite us to meetings and to continue the ongoing dialogue, which still continues today, and where we're meeting new community-based organizations and engaging them slowly in this process of improving the community's health. So here are some of our next steps. We're still doing or gathering community feedback, and we'll be formalizing the actual document for department review and approval. Establishing a memorandum of understanding with stakeholders. I think that's very important in terms of developing trust and validity with the process of the Community Health Improvement Plan process. You're demonstrating your commitment to working with the community health organization. Dissemination. It's important to share this information with stakeholders. A lot of times we create products and put them on a shelf, and that's where they die, on the shelf. And having an MOU and presenting this actual information to stakeholders really keeps them engaged, where they'll actually come to you and make you accountable to say, hey, you said you were going to do this, now let's work on following up on it. Quality improvement training. This is all about continuous quality improvement. And our idea is to provide quality improvement training and identify some small quality improvement projects that we can work with the community to identify whatever specific health issue they'd like to address and create a short, small project that they may be able to improve one of those outcomes and potentially improve the public's health. Mini grants. This is something that we're toying with right now, and the potential of providing some sort of tangible reinforcement incentive to really get them to continue to participate and be involved. And it may be only a $500 or $1,000 mini grant, but the idea behind it is there's a little bit of an incentive to keep them moving and keep them going. So these are just all the contributors that we've worked with, and a lot of these are member organizations that have a lot of different groups that work with them. And finally, here's our contact information. I do want to give you a couple websites that's not on here. The Health of Houston Survey, the website is www.hhs2010.net. And what that website can actually show you is some really cool data interaction with creating tables and mapping as it relates to community health indicators and demographics. So it's www.hhs2010.net. And then the other one is stateofhealthhouston.org. And if I get that wrong, that's what I remember off the top of my head. You can just Google State of Health Houston, Harris County, and it'll come right up. But then you can see an example of how they gathered existing data sources and put it together into a community health improvement plan. And with that, I'll turn it back over to Dr. Tracy. Thank you.